For decades, doctors and skeptics told men it was impossible. They said, listen, there's no safe way to actually increase the size of your penis outside of some painful, expensive surgery that your insurance may or may not cover. But what if they were wrong? So today what we're going to do is we're exposing the science-backed truth about a breakthrough combination of a simple in-clinic procedure and at-home techniques that could add nearly an inch in length and nearly a half an inch in girth without implants, without using anything synthetic to place in your body, and without any real gimmicks, right? So I'm Dr. Rachael Ross, board-certified family medicine physician, clinical sexologist, and founder of the Dr. Rachael Institute. Listen, this channel is all about an all-natural approach to men's sexual health. And if you're tired of being misled, having prescription meds shoved down your throat and told you it's never going to get any better, and if you are ready to learn real science and discover real solutions on sexual health and performance and optimization, then you are in the right place. We're closing in on 1 million subscribers. See, right here. So make sure that you hit that subscribe button and check out your free gift pinned in the comments below to get you started on this journey. So let's dive right in. Now, you know it. For years, doctors have repeated the same line. There's no proven way to safely increase your penis size outside of surgery. And if you're lucky enough to qualify for these surgeries that they're talking about, usually you have to have extremely severe erectile dysfunction. Then insurance might help cover it, might help cover the implants. Well, I'll be the first to say that those surgeries that they're marketing, that these pills that they're marketing and saying that they're going to make you bigger and plumper, those pills are a scam. And there isn't a pill that will actually do that, but there is another way. And let's be honest, you aren't looking for implants anyway if you're here on this channel. You're looking for something that's safe. You're looking for something that's natural and actually effective. And actually, if you have had some shrinkage, if you live long enough, you will. I have a video here on how to reverse that shrinkage. Now, a groundbreaking study published by Brandeis, MD, UCSF, and the Cellular Medicine Association revealed something really stunning that men here in our community have known for years, actually, but it's always nice to have researchers tell you the same thing. They combined using an at-home penis pump with a traction device worn throughout the day and combined it with a quick in-clinic PRP or platelet-rich plasma procedure in the clinic. And they did that every month for 6 months. And guess what? The results were pretty incredible. Now, the average length gain was almost 1 inch. It came in at 0.81 inches in just 6 months. The average girth gain, almost a half an inch at 0.47 inches. And the best part, all participants reported better erectile function after the completion of the 6 months. Now, this isn't some overnight miracle. It's a process that we've been talking about for years here on the Dr. Rachael Institute, but the numbers don't lie. And the best part, this method doesn't require synthetic fillers, implants, or risky surgeries. It's just really about harnessing your body's natural healing powers. Now, I know some of you are thinking, well, Doc, can I just skip the clinic and just do the at-home part? What kind of gains could you expect if you don't get the PRP shot? That's the big question, and we'll get to that in a moment. But first, let's talk about what's involved in what they have termed the P-long protocol. So step 1, the PRP injections. Once a month for 6 months, participants got ultrasound-guided PRP injections directly into the corpora cavernosum, which is the chambers responsible for erection. So they just put the shot right in there. Now, these injections put highly concentrated platelets, about 1.65 billion per treatment, into the tissue in order to stimulate regeneration and blood flow improvement to the tissue. Step 2, they did at-home traction. Now, twice a minute a day, for 20 minutes at a time, participants used a penile traction device. Sounds painful, but it's actually a device that you wear throughout the day that just applies a gentle stretch to encourage the tissue to grow and to elongate. It basically holds the tissue in a stretch position for about 40 minutes a day. You wear it underneath your clothes. It's pretty discreet, at your desk even, and nobody really knows that it's happening. Step 3, the vacuum erection pump, which is basically a penis pump that they used twice a day with a gauge on it, so a controlled pressure, for a total of 12 minutes, so 6 minutes at a time. And what the pump does, as you know, it stimulates circumferential growth, helping increase girth while improving circulation. Now, I've launched my P3 training system that is also linked below that'll train you on how to use my pumping protocols for gains. And then the fourth thing that they did for these gentlemen in the study is they gave them nitric oxide boosting supplements. So participants took a nitric oxide booster daily, every single day, in order to get nitric oxide levels up to boost blood flow, maximize erections, and I also have a link to my preferred nitric oxide booster below. Now, I know you're asking, well, doc, gee, it sounds doable, but what if you don't want to go to the clinic for the PRP? What if you're scared of shots? Can you still get gains just from using a traction device and a pump at home? Well, what I'm going to do is share a powerful, real-world testimonial from someone who's been in our community and has been at this for nearly 50 years. I want you to meet Michael Roberts. Michael has been using penis pumps and extenders since 1974. In his own words, using a pump is only temporary. And if you stop using the pump for 6 months, you're back to your original size. Michael doesn't stop there. He goes on to say he combined the penis pump with a penis extender, and that's when things changed for him. Quote, with the extender, I went from 6¼ inches to 7½ inches, and that's permanent. Even after 6 months of no device use, I kept the gains. My girth also increased more than my length. So his advice, use the pump and the extender together for best results for size gains. And Michael's right. You know, combining these tools is a proven method for incremental and lasting gains. Now, here's the real question. Every gent has to ask himself, how much extra length and girth do I need or do I want? And I think what you have to do is reach within and tell yourself, you know, actually, I'm perfect as I am. I just really need to optimize things. Better erection, improve blood flow, increase confidence. That's really what reality shows that you need to improve your erectile strength. And it's achievable without surgery. And if you're willing to follow a system, you've got it outlined. The only thing size-wise that really matters is if you're happy and whether you're content with yourself. You know, you're a complete package. And there is way more to you than just your size. So I want you to look in the mirror every morning, do this exercise, and just tell yourself, I am big enough. I am enough. And after 6 days even, you'll start to believe this. Hell, after 6 months in, you'll actually feel like a beast. So the choice is yours. You can work with what you've got, or you can optimize what you already have. And I've pinned a free gift below in the comments just to help you get started on that journey. Now, also, don't forget, I have another video that I did a while ago on a protocol to reverse that inevitable penile shrinkage that most men will get if you live long enough. Or, well, not Michael Roberts, who has put things into play to continue that optimization. So we're exposing the secrets big medicine doesn't really want you to know every single week here. And if you're ready to take control of your size, your performance, and your confidence, this is your channel. Don't forget to subscribe. I'm Dr. Rachael. I love you. And boom, I'm out.